Skin. Skin is the largest organ of our body. It's the only organ that one can see besides the many others which may be small, which means the skin can actually talk about all the conditions that we face, mental, physical, completely related to health. Have you examined your skin this morning? Did you look at yourself in the mirror this morning? What does it reflect? So welcome to the first ever webinar held by Dr. Batra today. We'll be discussing skin and all its related concerns. We have with us Dr. Rohini Talwar, who is an eminent dermatologist and has been practicing from the last 21 years. She is the head of our dermatology department at Dr. Batra's. We also have a co-host, Dr. Bindu Sharma, who is a homeopathic expert, and she is the director of medical services at Dr. Batra's. The topics that we would cover today would be all related to skin and its ailments, like acne, vitiligo, psoriasis, and many others. So while you have a question, all you need to do is the panel that shows on your screen, put in your details, put in your questions, and click on the submit button, and we'll be answering all your questions for you. And just in case during this seminar we are not able to answer all your questions, in that case we'll be answering them individually on your contact details. So I'll now put you on to Dr. Rohini Talwar to commence the session.
Hi, good morning everybody. She just mentioned that skin is the largest organ. All of us have our skin as the largest organ, but our heart should be larger. I think all of you agree with me. Skin is the mirror of the body. By mirror, what I mean is it reflects about your internal health. So anything goes wrong in your body, many a times it manifests on the skin in the form of some patches or some disease. And there are more than 2,000 diseases in skin. So 2,000 is a large number. So obviously the commonest ailment for which a patient goes to a doctor all over the world is a skin ailment. And they say that everybody in the world, each and every person has some skin problem or the other. I mean, I'm not saying everybody has a disease, but each one of us has at least pimples or dandruff or dry skin. So skin diseases are really important. Now, since it's the commonest disease, the commonest ailment for which people go to doctors, let me talk about the commonest disease out of the all these 2,000 skin disorders, and that would obviously be acne. Day in and day out in our OPDs, we are seeing patients of acne, also known as pimples. All of you know that it's a common problem of teenagers, but then actually speaking, it's not restricted to teenage. It starts at 12, 13, but it goes on till 25, 30 years. Now, we know that it's natural, it's normal, everybody gets pimples, so why treat pimples? It's part of your growing up, so why treat? There are two major reasons why we treat pimples. The first is pimples or acne will last till say maybe 25 or 30 years of age, but the scars and the marks which are left behind by pimples will accompany you for your life. So that's the first reason why we treat acne. And the second reason why we treat acne is acne comes at a time when you are in your teens and you're young and you want to look good, you want to make impression in the world. And that's the time if your face is getting riddled with all these boils and whiteheads and blackheads, then obviously it affects your confidence, you might slip into depression, you got a low self-esteem, and for that we need a treatment of pimples. Now, what causes pimples? Obviously, it's the hormonal upswing which occurs at the onset of puberty. Puberty is the time when a child is becoming a young adult. And so, this upswing of hormones lead to excessive oily skin, blocking of the pores and acne. Genetics has a part to play. If your parents, if your siblings have acne, more likely that you will have acne. Your diet has a significant part. Medical research has proved that a diet with high glycemic index like sweets or fried food or fast food, all these things lead to increase in acne. Your cosmetics have a part to play. Cosmetics block your pores, that's very obvious, but there are some cosmetics which are comedogenic. We always tell our patients of acne that whenever they go to buy products, they should say that the product is non-comedogenic. Comedone is this whitehead or blackhead. So some cosmetics have some chemicals which lead to blackheads and whiteheads. So cosmetics can be a cause. And last but not the least, in females, PCOD, polycystic ovarian disease, is a disease of ovaries which leads to a lot of imbalance of hormones in the body, and that could be a common cause for acne. I'll tell you some simple tips for acne. One, first and foremost, some of the patients will wash their face once a day and some of them will wash 15 times a day. Now both extremes are wrong. You must wash your face 2 to 3 times a day depending on the weather. If it is summer, maybe it is 3 or 4 times. If it's winter, maybe it is 2 times. But 2 to 3 times is ideal with a face wash that suits your skin. Take care of your diet. Do not, I mean, that's the age where you're into fast food, but try and avoid fast food as much as possible. Go in for green leafy vegetables, all kinds of fruits, salads. It definitely will make your acne much better. Drink a lot of water. Hydration plays a part. Do not ever fiddle with your pimples. The more you fiddle with your pimples, more are the chances that you get the marks and the bad scars. And be under care of a doctor. Like, there are people who apply toothpaste for acne, or your neighbor's cream or your friend's cream. No, that's not the solution. You must consult a doctor, and whatever the doctor advises you, depending on your skin, your acne, your situation, that's the right remedy for you. So this, I spoke a little bit about acne. Let me talk a little bit about vitiligo. I'll tell you why vitiligo. Why is it important? This is one disease which is full of misconceptions and full of fear. People have a lot of fear about vitiligo. I mean, I see in my OPD, people come with these white patches, they show me and they're looking at me and I can see the anxiety on their face whether I'm going to say it is vitiligo or leukoderma in colloquial terms, or I'm going to say it is not vitiligo. As if the whole life depends on that answer to that question, doctor, is this leukoderma? Very important thing. Vitiligo, as all of you know, is leukoderma or white patches. Most important thing, every white or off-white patch on the body is not vitiligo. There are so many reasons for white patches and off-white patches. There can be fungal infections, there are types of eczemas, there are types of moles which are in childhood, and there are so many age-related conditions. There are so many conditions which come as white and off-white. So do not get disturbed, do not get distressed if something is white on your body. Does not necessarily mean that you got vitiligo. You must go to the doctor and check whether it is vitiligo or no vitiligo. And even if it is vitiligo, there is nothing to get scared about it. Vitiligo can be treated. It's an autoimmune disease. Auto means self, immune means resistance, where your own body's resistance is killing your pigment cells, which are known as melanocytes. So when melanocytes are killed, the melanin, which is the skin pigment, is lost, and that is why you get those white patches. But there are a variety of remedies available for vitiligo, and we also need to check whether patient has thyroid, because this is associated, or diabetes, and vitiligo can be taken care of. Again, I will give you some general tips. First thing is vitiligo skin. Supposing you have a leukoderma patch on the exposed part, our skin is protected from sunlight because of the color. So when you go out and you have a vitiligo patch, that patch is not protected from sunlight and it's very easy to get sunburn. So please put a good SPF sunscreen, SPF above 30 on that patch half an hour before sun exposure. The second tip is vitiligo always increases with trauma. By trauma, I mean injury. Now there are various types of injuries that you can have on your skin. Like it could be an accident, it could be a burn, it could be a cut, it could be simple friction, like you're sitting cross-legged on the floor, your ankle is getting friction. So these kind of frictional activities, or you're taking bath with a very harsh scrubber, that's a friction. So avoid that. And in today's generation is into tattooing of the skin and body piercing. Now remember, tattooing, body piercing are all kinds of body traumas. So if you are a patient of vitiligo, then please avoid tattooing and body piercing. So that's a little bit about vitiligo, which is one of the commonest illness that we see in India. 1 to 2% of Indian population has vitiligo. And as of today, I just checked, 1.31 billion is our population. and 1 to 2% is 1.3 to 2.6 crore patients. We're looking at an alarmingly high number. A population of entire country like Sri Lanka, say, is 2 crore, and we have more than that just vitiligo patients in our country. So it's a huge public health concern, but as I said, vitiligo has answers, and people do lead a very normal life. There is no need of getting depressed because of vitiligo, because beauty is not skin deep, and your worth as a person definitely does not depend on your skin color. So obviously there are treatments available, and you should seek for treatment. And a few things about psoriasis, because that's also one of the common disease that we encounter. Psoriasis is red, scaly, itchy, dry, rough skin. So skin basically becomes red, it becomes itchy, scaly, the scales are white in color, sometimes the scale fall off, sometimes they are sticking. It may not shorten your life, but the quality of life gets severely affected because of psoriasis. Because if you got say psoriasis on the hands or psoriasis on the feet, it leads to fissuring. The skin gets cut, and then there can be bleeding, and there can be pain while you're walking. Or psoriasis can have manifestation in the joints. So if you get psoriatic arthropathy, then it's, you get pain in the joints, you get joint swelling, difficulty to move the joint. So quality of life is something which is majorly affected by psoriasis. And there are certain serious variants of psoriasis, like say pustular psoriasis, where patient starts getting pus everywhere. Now those are dangerous. What exactly is psoriasis? If you ask me, it's excessive production of skin cells. The skin, which should mature from lower layer to upper layer in 3 to 4 days, because of excess chemicals gets matured, it should get mature in 30 days. Because of excess chemicals, in psoriasis, it gets matured in 3 to 4 days. So if your skin is being formed in such huge amount, then obviously the skin doesn't get exfoliated, it remains there, and those are the plaques of psoriasis. I think some of you have started asking some questions, and I have one question here which appears to be quite relevant. Nuru Sabah Sheikh is asking that is there something effective for pimple free skin? She's tried almost everything, and is this condition related to PCOS? Now hello Nuru Sabah. I don't know what you mean by you tried almost everything, because the therapeutics of acne is a very large thing. Of course there is homeopathy, and there are many things in allopathy as well. So first and foremost is you have to go to a doctor, get yourself evaluated, and you've asked a question whether it is related to PCOS. Well, it can be related to PCOS. If you have PCOS, there would be certain signs and symptoms. You may have hair growth on your mustache, or maybe hair growth in the beard area, or maybe you have hair fall from the scalp, or maybe you're putting on weight and your acne are really bad. So there are many signs and symptoms in PCOS. Maybe your periods are irregular. So the doctor has to evaluate as to what signs and symptoms you're presenting. Certain investigations are needed, and then only we are going to label you as PCOS. Unless we do investigations, we don't label anybody as PCOS. There's another question here from Mr. Farooq Ansari. He's saying that I have to wear t-shirt always, and my hands are black. So what is the solution? A country like India, where we have sun almost throughout, obviously tanning is a big problem. The solution for tanning are many, starting from not going out of the house, which is impractical for most of us. But to cover yourself is one good solution. I know you're wearing a t-shirt, but that doesn't prevent you from wearing some coat or some gloves on your hands, so that is protected from sunlight. To put a good SPF sunscreen half an hour before going out in sunlight. You may wear a cap for your face. You may carry an umbrella. You may decide not to walk too much in hot sun. Definitely not between 10 o'clock to 4 o'clock. You may decide to go by a vehicle. So these are various things that you can do so that your hands do not get tanned. Once it gets tanned, there are certain creams available. Dr. Batra's has a skin lightening cream that would help you. If at night you put the skin lightening cream, slowly the skin color, which is the tanning, fades away. Tanning is never permanent. It takes time. It depends on how much time you have tanned. I mean, the more are the months and years that you have tanned, the more the time it will need to fade the tan. So that's one more question. And there are a few more questions Rita is asked, at times I have uncontrollable itching on my fingers and earlobes. Why is that and what to do? Well, uncontrollable itching on fingers and earlobes, I would need a little bit more information on this. Rita, maybe you are an allergic person. An allergic person generally has a tendency to get itching whenever they are exposed to things that they are allergic to. And you can be allergic to anything under the sun, including the sun. So maybe your earlobe itching can be related to you're going out and you're getting itching because of the sunlight. It's summertime nowadays. What to do? As I said, first of all, we have to find out the cause. Why are you getting itching? What exactly is the diagnosis? Treatment obviously depends on what the diagnosis is, but simple things that you can do is cover your earlobes as far as possible. And whenever you get these spasms of itching, you can take some ice in a hanky or some cold water and immediately apply to the area which is itchy. The cold water or the ice would numb your skin and you would feel relief with this. Rajamani Kamwani is asking, I have melasma on my face and please tell the medicine of this problem. Melasma is also known as mask of pregnancy. Why? Because it's common in pregnancy, but pregnancy, after pregnancy and delivery. But that doesn't mean males don't get melasma. That doesn't mean teenage girls don't get melasma. Menopause also is another cause of melasma. You are asking me for medicine of this problem. I think we have Dr. Bindu Sharma here, who's our director, and she's an eminent homeopath, and she would like to talk about medicine of melasma. She will enlighten you.
Hi, Vani. Sorry to spell your name not properly. See, melasma is again, as Dr. Talwar said, that it's a lot to related with females and very common problem in females. And there are two types of melasma. Like, one is superficial, which is epidermal, and second is dermal, which is little deeper pigmentation. So if you have a superficial pigmentation, of course it does fade away a lot with homeopathic medicines, but we need to really understand what are your causes and all, so you need to consult the doctor. But definitely what is important is that you make sure that you're using the sunscreen, which I think Dr. Talwar has already addressed. And we do have miraculous, in case till you visit, you can take the whitening cream, which also we have seen a lot of patients the melasma has disappeared with. So I think these are the two things which we can do for the melasma.
Sebat is asking on Facebook, I have acne problem on my face. I'm 19 years old and I'm taking medicines for about 2 months and I'm thinking to go for laser treatment. What should I do? Now Sebat, first of all, you're 19 years old. So yours is the age when getting acne is not a huge big deal or a disease. First thing, it's normal. Of course, you're concerned about it. From your question I can make out. You are taking medicine for about 2 months. 2 months is a little short period. Whether it is allopathy, homeopathy or whichever pathy you are taking, 2 months is a short period. Acne needs a little more sustained treatment. So one thing is you have to have patience, to wait and for the results. I told you some things about acne, like taking care of your diet, right? If washing your face. These are simple things. Taking care of your dandruff. The more the dandruff, more the acne. So use some anti-dandruff shampoo. Dr. Batra has an anti-dandruff shampoo. You can use it alternate days. You can use some natural remedies if your skin is very oily. Multani mitti is one natural remedy which has been used for ages. You can make a multani mitti with rose water face pack and apply it twice a week on your face, which will make your face less oily. Wait for your medicines to act. You are thinking to go for laser treatment. Great idea. The thing is, if you do a laser treatment, yes, it works. But then acne is a hormonal thing. You do laser treatment, your acne will disappear. But because your hormones will not disappear, your acne will reappear. So please be aware that whatever treatments you want to undergo, whatever are the cost, please be aware that acne is something which cannot be cured in the sense disappear. That disappears with age. That disappears when you take care of your skin. As I mentioned, you take care of your diet. All those things go in a long way in helping your acne. So laser treatment, yes, temporarily it will help you. You undergo 2 or 3 sessions of laser by a dermatologist who is well equipped in handling the laser, and your acne would disappear. But then acne can reappear. So remember that, and maybe Dr. Bindu can tell you about homeopathy and acne.
Yeah. I mean, homeopathy has a beautiful action on acne. As Dr. Talwar said, that you have to go to the root cause, and the root causes are 2, 3, 4, 5, what she told you at the start of the treatment. So what we also do is that we try to understand what are your causes, and homeopathy is completely personality based medicine. So it's not that all the acne patients will get the same medicine. That's why you need to consult the doctor. Just don't take haphazardly. So basically we understand your cause, and according to your personality we give you the homeopathic medicines, and we get beautiful results within, of course, as you said, 2 months is too less. You have to give some time, and of course lot of diet control and lot of other stuff.
Taking care of your skin basically, not to fiddle with them, because you will be left with scars and marks and all those things.
I mean, see, basically if you see Dr. Batra's products, they all are medicated with the homeopathic medicines, and till you consult the doctor, if you don't have time, please pick up the cream and apply it. I mean, it really works very well, because it decreases the oiliness of the glands, which is main reason, the increased sebaceous, increased oiliness on the face gives you this, and then all the whole cycle starts. So at least use that acne cream, and we can definitely help you.
Priya is asking, whenever I have stress, I get eczema on my face. So what do I do? So I think, Riya, you have answered your own question. Whenever you get stress, you get eczema. So obviously you have to take care of your stress. It's very easy to say to take care of stress. It's difficult to take care of stress. I know that. There are various techniques which help in taking care of stress. There are meditative techniques. There are ways of focusing, etc., etc. Basically all the treatments which see to it that your mind is peaceful, because if your eczema is related to a mind, then obviously your mind has to be treated, and then your eczema takes care of itself. Rather than applying ointments, you apply ointment, it goes. But if you are under stress all the time because of your education, your career, your personal life, whatever it is, your eczema will keep recurring. So taking care of stress is the answer to your question. So maybe Dr. Bindu can talk about how homeopathy can take care of stress.
Yes, I would say that homeopathy has a very upper hand compared to the other therapies, because this is the only medicine in the world which affects the emotions of the patients without any side effect. What I mean by this is that I told you that it is personality based. So whatever the excessive emotions, like you have excess anxiety, it comes down to normal anxiety. You can't become anxiety less, then you will not work. Okay, so you have a normal level of emotional aspect. So homeopathy, any heightened emotions, it reduces. It does help you to cope with the stress in much better way. You do become very calm and cool, and of course along with that you should do meditation and yoga and many other techniques which Dr. Talwar said. So I think homeopathy has a very good result for stress.
Irfan Wani is asking, I have got pimples on my face and dark spots. I am looking very ugly. Please tell me the medicine of my ugliness. First and foremost, Irfan, nobody is ugly. We don't call any of our patients as ugly. You're not ugly. Obviously not. You get some pimples on the face doesn't make you ugly. So first of all, remove that notion. You're not ugly. Okay. We've talked enough about how to take care of your pimples. There are so many ways, ways of taking care of your skin, your diet, your stress. You're taking care of your dandruff and all those things, and natural remedies, and you take care of that, and you are beautiful. I mean, you're Irfan, so you're handsome and you'll become more handsome. So no ugly word. Madhuri Soni is asking, I get a lot of acne and my skin is dry. I have tried every product, nothing has helped. I also have thyroid. What to do? Madhuri, first of all, I'm a little surprised you're saying you've got a lot of acne and skin is dry. Maybe the skin is dry because you're using many products. Most of the acne products which are available in the market are there to make your skin dry. So your skin might have become dry because of using all these variety of products. Now nothing has helped. If nothing has helped and you also have thyroid, then obviously this is a reason enough for you to go to a doctor and get yourself evaluated as to what exactly is wrong. Why are you getting acne? Why are you getting dry skin? And whether your thyroid is under control or no. Right. So again, homeopathy will help you. Let Dr. Bindu talk a little bit about this thyroid and acne.
So thyroid is again, it's a very common problem which females are getting. I think every fourth woman is suffering from thyroid, and I mean the real reasons of that is not known. But of course the lifestyle and the way things are there, I think the thyroid has become thyroid and PCOD. These are the two culprit for all the problems in the females right now what people are facing in the world. Of course thyroid, there are two types of thyroid, which is one is autoimmune and another is simple thyroid. And in both the conditions, of course, you have to control it. Once you control it, of course, your skin gets affected with thyroid, your hair gets affected with your thyroid, and of course, many other aspects of the it's a multi-system disease. So basically, of course, homeopathy has a very good treatment, but you should not take any specific medicines. You should only take constitutional medicines, which really definitely helps to bring down your thyroid levels. So we have really good results.
Okay. Manish Sharma is asking, I am having severe hair fall due to psoriasis. Will it grow back after treatment? I presume, Manish, you have got psoriasis of the scalp. Because if you got psoriasis of the scalp, then yes, hair fall can occur. And once your psoriasis is under control, all your hair will come back. If psoriasis is the reason for your hair fall, because hair fall can have so many reasons, but since you are a patient of psoriasis, I presume you got psoriasis of the scalp and that is leading to hair fall. Your hair fall will come under control once your psoriasis is under control. As simple as that. Sahil Sharma is asking, I am 22 years old and as common in teenagers, I also suffer from acne and I still get pimples. And the worst part is the pimples leave dark spots on my face even if I don't touch it. I have these dark spots on my cheeks. Now, since you said in your webinar that dark spots and scars stay for lifetime, I want to know if there is a treatment for these dark spots and can I have a clear complexion? Very good question, Sahil. This is something which many people, many patients tell me, that I don't touch my pimples and it still leaves behind dark spots and it still leaves behind scars. Well, when you come to pimples, there are many grades of pimples. Grade 1, grade 2, grade 3. Grade 1 are those small, tiny whiteheads and blackheads that you get. They rarely leave behind scars. Grade 2 is when you get some red colored boils or yellow colored boils. That's grade 2. And grade 3 is the worst, where you get those huge big cysts, we call in our language. I mean those thick big boils. Now, if you are a grade 2, grade 3 patient, then even if you don't touch your pimples, because they are big, the inflammation in the skin is very, to a large extent. When it disappears, it invariably leaves behind dark spots and marks. Not your fault at all. Now, today you have these dark spots. Peels is a wonderful answer. Apart from Dr. Batra's skin lightening cream, which is there, and there are other skin lightening creams in the market. Chemical peeling is one addition in our therapeutics recently, since last 10-15 years. Chemical peelings work wonderfully well for dark spots. Mind you, it doesn't work for scars. Scars is different, spots are different. Spots are on the surface of your skin, the color is darker. Scars is where you get those depressions. I'm talking about your dark spots. Peels work wonderfully well, creams work wonderfully well, and time is the biggest healer. Time also works wonderfully well in dark spots. So you can wait and watch whether your dark spots are fading with time. You can use Dr. Batra's lightening cream and you can go in for peeling treatment. We have Dr. Batra's aesthetic division where peels are done. There are many peels which work in your dark spots. Kojic peel works and lactic peel works. So let the doctor decide as to which peel would work for you, and there is a solution for this problem. Not a big problem at all, not to get depressed at all. Monica is asking, hi, my lips are getting darker day by day. I don't even smoke. What can be the issue? Lips getting darker, yes, smoking is one reason which you are not doing. Lipstick is another reason. Many a times lipstick contain chemicals which does not suit your skin. If you are an allergic type of person, then even if you take a lipstick from very good company, there are chances that your lips may turn black. Another reason for lips turning black is if you have a habit of playing with your lips. There are people who keep on pursing their lips, there are people who keep on biting their lips. Some lip movement, when they are under stress, they are doing some lip movements all the time. If you are doing lip movements all the time, your lips are all the time under friction, your lips may turn dark. Another thing is, Monica, if you are a dark skinned person, a dark skinned person generally has dark lips. A fair skinned person generally has red lips. So if you are a dark skinned person, then there is hardly anything that can be done for your dark lips. But if it is due to your, as I said, lip movements or some lipstick, or maybe you use some lipstick which did not suit you at all, then that is where the problem lies. And I think again homeopathy is something which goes to the core and tries to find out your your constitution. So if you go to a homeopathic doctor, maybe he's the one who can find out. Dr. Bindu, you can tell her more about it.
Yeah, I mean pigmentation and the, like the previous question, also the acne. So basically time is the most important, and of course the lip means we'll have to find the cause. Once you find the cause, we can treat it, but then once you find the cause and you avoid it also, you become normal with the time. So it's very important to identify the cause.
And one more thing that I have noticed with my patients is, when your lips turn dark, you generally have a tendency to put on more and more of lipstick. So if the lipstick is the culprit, then you are putting the culprit more and more. So in order to avoid the dark lips. Hema is asking, how safe is glycolic peel for hyperpigmentation, especially on the face? Would there be any side effects like dark patches? There's a band on the skin above my upper lips. Will glycolic peel help remove the black band? Okay, I do not know why you got a band on your skin on the upper lip. What's the reason for that band? We'll have to find out. To examine the patient to find out as to what are you talking exactly about. What must be the reason for that black patch on your upper lip? Will glycolic peel help? Glycolic peel helps in pigmentation. It doesn't help in one sitting. You need 5 or 6 sittings. But the most important part in any procedure, whether it is peel, whether it is laser, whether it is whatever, you have to go to a trained doctor to do this. I am not against anybody, but when you go to beauty parlors, the salons and things like that, if there are not trained individuals who are doing your peels, if they are not trained, aesthetically trained, then there are chances of things going wrong, and then you getting what you mentioned, you getting side effects like dark patches. So that is why it's very extremely important that you go to a person who is a doctor, who has taken training, who knows how to deal with peels, how to deal with complications of peel, how to see to it that complications of the peel do not occur, and how to do these procedures safely. Whenever in safe hands, you are assured of results and you do not get all these complications. Aniket is asking, is hair fall a cause for acne, and if it is so, how to prevent it? Well, hair fall, in Aniket, you are a boy, hair fall has nothing to do with acne. Hair fall doesn't cause acne, acne doesn't cause hair fall. In females, yes, in females, if they are suffering from PCOD, then acne and hair fall goes hand in hand. But otherwise, in males, hair fall is a separate thing and acne is a separate thing. Madhuri Date is asking, I am 46 and still I suffer from acne. Can you recommend any cream to fight acne and get clear skin? Madam, on the lighter note, you are 46 and you still get acne, so I must compliment you, you are young. That's the first thing. I wish I got acne. Anyways, any cream for acne? It's really difficult for me to recommend creams without examining you. Need to see you. At 46 is not a common age to get acne. So need to see you, find out what is the reason. Are you menopausal, or you still could be a case of PCOD. We have Dr. Batra's Acne Cream, which is available at our Acne Cream and oil control face wash. So these things can be tried. Otherwise, Dr. Bindu will advise you.
Find the cause.
Yeah.
as Dr. Talwar said, I think you should consult and come to the right, what is the root cause. Because see, applying cream and all, to certain extent it will help. But then unless until you find out actual cause and treat it, the problem recurs. So I think the consultation is better, to show it personally to consultants.
Mehul Parmar is asking, I have got small white dots in clusters on my arms, legs and chest, and they are spreading and they are getting bigger in size. Now, as I said, in vitiligo, Mehul, you got small white dots doesn't mean you got vitiligo. There are so many causes of white patches on the skin. So do not assume first of all that you got vitiligo. You have to, you have to go to a doctor, find out what is the causes of your white dots which are there in clusters, why are they spreading, and get treated. Very difficult for me to diagnose based on your treatment, but please do not assume that you got vitiligo. Aniket Modi is saying, I am 14 years old and I am taking treatment for about 1 year and 4 months, but these pimples are still occurring. So can you suggest a diet for it? Very good question. Aniket, you are 14 years old and you are taking treatment and they are still occurring. They will keep on occurring. Okay, with treatment, what will happen is they will occur less. They will be smaller and they won't occur as frequently as they were occurring. So your frequency of acne goes down with treatment, your severity of acne goes down with treatment. Okay, so that's what we are looking at. When you are taking treatment, you should be clear as to what you are looking at, what is the treatment going to achieve for you. If that is clear, you will be happy with your treatment, right? So your severity of acne will go down over a period of time, your frequency of acne will go down over a period of time. And now you want me to suggest a diet. There are groups are divided into high glycemic index and low glycemic index. Now let me explain to you what is high glycemic index. A food with high glycemic index gives an immediate raise of blood sugar high and then immediately it comes down. The typical example is a chocolate. You eat a chocolate, your blood sugar immediately shoots up, after some time it shoots down. So what are these high glycemic index foods? These are the foods which has been proved to increase acne. So all your chocolates and your biscuits, on your chips and all your fast food, you think of it, Aniket, and that comes in high glycemic index. Because most of the fast food is made up of potato and maida and cheese and butter. So your vada pavs and your Frankies and your Chinese and your bhel puri and your samosas and pastas and pizzas and burgers, and I'm sorry, but all these are high glycemic index foods and they are not, they're junk food and they don't do anything good for your skin, nor do they do anything good for your health. Okay, you just feel that your stomach is full, that's all. These are empty calories. You're getting calories, you might put on weight if you eat it too much, you don't get any nutrition out of it. You're eating a high glycemic index food. You need to avoid all these things. You're 14 years old, I know that I'm telling you impossible things. So maybe once a week you can indulge, but rest 6 days of the week, you must stick to the proper gharelu khana. You have to eat rotis and you have to eat bhakris of jowar and bajra and ragi. These are low glycemic index, right? I know I'm talking Greek and Latin to a 14-year-old boy, but then if he wants a diet, then that's what I'm going to give. So you're supposed to eat these bhakris, maybe ask your mother or grandmother about it. You're supposed to eat all vegetables, everything, all colored vegetables. Different colored vegetables have different vitamins, different antioxidants, different minerals, and body needs everything, right? So your purple vegetables like baingan, and you've got green leafy vegetables like all palak and methi and chauli, and you've got yellow vegetables which is vitamin A, you've got this red pumpkin, and I'm sure 14-year-old children don't even look at red pumpkin, and carrots and mangoes. These are red vegetables or yellow vegetables which gives you vitamin A, and body needs everything. You need to eat lots of salads, you need to drink lot of water. Okay, so these are the basic things in diet that I can suggest to you regarding your acne, and believe me, you will see the transformation in your skin. You have to eat out, you don't have time, you can eat idlis. Idli is very nutritious, it is full of protein and it does not have oil, right? So you can have idlis. You can have dosas which are not butter dosas or cheese dosas. You can eat simple dosas. You can have sandwiches which are not cheese sandwiches. You can have vegetable sandwiches. These, if you're outside and you can eat fruits. You're hungry, eat a banana. That's much better than buying chips or whatever packets that you buy from. So that's about your diet. And avoid cakes and avoid ice creams, and without me saying, avoid cold drinks or all colas. So Aniket, I hope you're clear what to eat and what not to eat. Charanjit is saying, I get pimples in regular intervals, and due to pimples I have pores on my skin, and how can I reduce these pores? Good question, Charanjit. I don't know if it's Charanjit Singh or Charanjit Kaur, but whoever you are. What are these pores? When you get acne, basically, you got oily skin, and the oil glands secrete oil on the surface of skin, and that opening of that gland is the pore. So obviously when you got acne, your glands are big, your oil glands are big, secreting a lot of oil. So obviously the pore of the gland is big, and those are those pores that you're talking about, right? There's something called as, obviously you need treatment for your pimples, but there's something called as toners. Dr. Batra says a non-alcoholic toner. Alcohol dries up the skin, irritates the skin. So if you use toners regularly, toners is something which can take care of your pores. It makes the pores smaller, right? Kesar Kant, I want to ask about the solution for old and deep marks on my face. Well, if the marks are deep and if the marks are old, then I do not think so medical treatment would help you. You need a surgical treatment. You need a microdermabrasion, or maybe you need a derma roller treatment. This is we are talking of surgical treatment here. So you need to go to a dermatologist or a plastic surgeon who can take care of your deep and old marks. It's not easy. Laser treatments are available for deep and old marks, but let me tell you, if they're too deep, then the skin may not become completely as it was before the marks. The marks would become superficial. They may not reduce. So you are calling it deep. Maybe the doctor, when he sees you, will say it's superficial. It can be taken care of. So you need a consultation from a doctor. Juliet is asking, what medicine should I take for pigmentation? So let Dr. Bindu answer you as to what medicines.
I think there are no specific medicines for pigmentations. There are no specific. Homeopathy has few specifics, but for pigmentations, overall you will have to take a constitutional treatment, and it depends what kind of problem and where pigmentations you have. There are many causes of pigmentation. So first of all, we have to identify what are the causes, and accordingly we treat. So don't go for specific medicines and all.
Yeah, similarly, Lalit Kumar is asking, I am suffering from psoriasis for last 2 years, and I have it on my fingers and hips and genital area. So please tell me what is the cure. Again, I think Dr. Bindu is better equipped to deal with it. He's got psoriasis on his fingers, hips and genital area, and he wants the cure.
Yeah, so Mehul, right?
Lalit Kumar.
Okay. He's a 31-year-old.
31-year-old from Gurgaon.
Last 2 years only. So basically, as we, Dr. Talwar spoke in the beginning of the webinar, that it's an autoimmune disorder, and we have seen that psoriasis is very much associated with anxiety. Anxious people are more prone for psoriasis. There are a lot of research studies. So what is important, Lalit, it is for you is that you have to control your lot of stress, underlying stress levels and anxiety. The stress is one of the most important factor in psoriasis. So basically, we need to make sure that underlying stress, and of course we can't take away stress with the homeopathic medicine, but your ability to cope with the stress really improves to a great extent. And then of course the anxiety and other problems can be taken care of. Because you are 31-year-old and because you have psoriasis since 2 years, it's better that you get treated fast, because there are a lot of complications of psoriasis. So basically, I think we can definitely help you in great. Any homeopathic doctor can also help you. So please take a proper constitutional treatment for psoriasis.
Harshita Makim is asking, I have a very dry skin. If I use normal cream, it doesn't last for a long time, only few hours. Is there any solution or cream or remedy for dry skin? Extremely dry skin is something which you should find out as to why are you getting dry skin. Is it constitutional? Is it genetic that everybody in your family has dry skin? A condition like ichthysis? or I don't know what age you are. Is it age related that you're above 40 or 50, or are you a thyroid patient? What is the cause of your dry skin? Are you an allergic person? We call it atopics. They have dry skin. Whatever it is, need to find out first of all the cause, and remedy is well, age old remedy is oil. Obviously coconut oil will keep your skin very hydrated and moisturized, but then it's little impractical. We have Dr. Batra's moisturizing creams, Vaseline and other things are also available in the market, so you can keep using them. If it doesn't work once, then maybe you have to use it twice or thrice. It depends on the level of dryness that you have. The more the drier the skin, more is the frequency of application. So before that, I think you should find out why you've got dry skin. Is there any remedy for your basic cause? Mahesh Saha is asking, I have vitiligo with number of white patches on hands and legs measuring approximately 1 square centimeter to 10 square centimeter. I am suffering from it for last 27 years. I am taking tablet melanosil 20 milligram 2 times a week, taking Shinofit, which is a vitamin and mineral tablet, 1 daily at bedtime, and an ointment. Spread of the disease has almost stopped, but it's yet to be cured. A new patch is visible now on the left toe, and I am taking Thyronorm tablet daily for hypothyroidism. Please advise remedy. Hypothyroidism and vitiligo go hand in hand. They are related. The thyroid should be under control. You are taking Thyronorm 50 milligram daily, fair enough. Every 6 monthly, keep doing your thyroid profile to see to it that your TSH levels, T3 and T4 levels are within normal limit. What can be done for your new patch on the left toe? Let Dr. Bindu take your question.
See, basically, I think you're already taking melanosil tablet and
Some ointment.
Some also you're applying, and it has helped you to great extent, but the new patches have come. See, basically vitiligo is a very unpredictable. It may disappear for 10 years and it may come back on 11th year, or it may just go away and it never come back, or you are taking the treatment and still new patches can come. Okay, so basically I would advise that you continue if you are getting better with the medicines for some time, little more, ask the doctor. And I would also advise you to add homeopathic treatment, because homeopathy does not interact with allopathy. You can take both the medicines together. We do not taper off allopathic medicines at all. For us, it is important that patient gets better. So whichever treatment is helping you, never stop it. Keep taking it till whatever it gives you the best result, and you can combine homeopathy with that.
Monica Gupta is asking, I have a very uneven skin tone. My hands are comparatively fairer than my palms. I have a very dark knuckles, and this is not because of the tan. So please help me with this solution. Dark knuckles can be due to 2 or 3 reasons. It could be genetic, one. Secondly, if you have a habit of friction, your knuckles undergoing friction. There are some people who just by sitting they'll keep doing some movements on the table. So if your knuckles are undergoing any kind of friction, they're going to become dark. Vitamin B12 deficiency is a common reason for dark knuckles. So I think, Monica, you need to go to a doctor, find out your vitamin B12 level, especially if you're a vegetarian. Maybe you have a vitamin B12 deficiency which is contributing to these dark knuckles. So if your doctor does your test, and if B12 levels are low, he will give you vitamin B12 tablets and injection form, and your dark knuckles would disappear. Simple as that. Varun Pratap Singh is saying, is there any solution for Acanthosis nigricans? There are black velvety patches around the neck for last 2 years, and after consulting a doctor, I undergo sugar test and I found my sugar level around 125 fasting. After diet control and exercise, my sugar level is 105 fasting. No improvement in patches. Kindly suggest. I am 31 years old. Varun Pratap Singh, first of all, very good, congratulations. You are following a good lifestyle now. You got diet control, you got exercise, so please continue. Your sugar has come from 125 to 105, which is also very good. Acanthosis nigricans is because of insulin resistance. A diabetic patient has insulin resistance. You are a diabetic, so you have insulin resistance. The moment your sugar comes back to normal, acanthosis doesn't disappear overnight. Keep your sugar in normal level for months and years, and acanthosis will slowly disappear. One more thing I would like to suggest is check your weight. If you're overweight, if you're obese, if your BMI is about 25 or 24, get your BMI down to 21, 22. If your BMI comes down to, I hope you know it's BMI, body mass index. So that's calculated by dividing your weight by height in squares in meters. So if your weight is under control, if your sugar is under control, your acanthosis takes care of itself. It doesn't need anything more. So see that these 2 points are taken care of, Varun Pratap Singh, and your acanthosis would disappear. And to tell you the truth, if you do not take care of your sugar and if you do not take care of weight, then all the medicines in the world, whether it is application or oral, is not going to help the acanthosis nigricans, because the root cause is insulin resistance. And by doing this diet, that's why I said I'm very happy, by doing diet and exercise you are taking, you're tackling your insulin resistance, and that is the answer for your acanthosis nigricans. Aishwarya is asking, how do I get rid of my white patches on my elbow? Again, Aishwarya, white patches on my elbow, on your elbow, could be anything. Could be vitiligo, may not be vitiligo. Unless we see the patient, examine him, you correctly, properly, I won't be able to answer this. Just to give a simple tip to you, because I don't know where you are and which doctor you can find, is you can do a early morning sun exposure. Nowadays summer, so sun comes by around 7:30. Around that time you just expose your elbows at around 7:30 for around 10 minutes every day. It shouldn't be at 10 o'clock or 11 o'clock when the sun is very harsh. That would burn your skin. But 7:30 early morning, if you expose your elbows to sunlight, say around 5 to 10 minutes every day, if it's a minor thing, it would disappear. But obviously vitiligo or some major disease would not disappear this way. Then you would need a consultation from the doctor and a proper remedy. I think we've tackled many questions. Nikki Kaur is saying, I am getting moles on my neck and now it started on my forehead. So please suggest me for good clean skin. Nikki, mole is a very vague term. You do not know what moles. Moles could be skin tags, moles could be your birthmarks, mole could be warts. There are so many things which in colloquial language is called moles. So unless you come and see your doctor, what kind of moles you have, and then we can suggest you the remedy to take care of your
post the photograph also.
Moles. Yeah,
difficult
maybe.
to diagnose, but if
Yeah.
you take the proper photograph, we can get back to you. Yeah? Okay.
Okay.
Thank you, Dr. Sharma and Dr. Talwar. We're just about completing our session. We have tons of questions coming in, but it was an 11 to 12 session, and I'm sure we'll be able to answer all your queries individually since you've left your contact details with us. All the inputs, I must say, have been very valuable. I'm sure we all got directions on the solutions that we should be taking. I got a tip or two also. And thank you all for attending this webinar. Dr. Batra has a team of over 375 homeopathic doctors, and we treat all health concerns globally. We would be conducting many more webinars. The next one that is coming up is on the 13th of April. That's at 11 a.m. That's a Wednesday. We would be discussing hair-related concerns on that day, and the one who would be conducting this seminar would be Dr. Akshay Batra himself. He is the managing director for Dr. Batra's. He's a homeopathic expert and the first ever Asian trichologist. He would be conducting the seminar, the webinar on all hair-related queries. So we hope to see you then, and we look forward to more such interactive webinars and keeping up with the vision of Swasth India. Thank you so much.
Thank you.
Thank you so much. Thank you all of you.